I should take a step back. I was part of, I really helped lead a group of 20 freshmen to block any effort to vote on this bill before August. I thought it was extremely important for us to take a deep breath, bring this out to the American people, hear what they had to say. I wanted to go to all the hospitals in my district, have them go through the numbers, see whether this was going to make them better off or worse off. I was down at the hospital today working on that conversation. Take the time. I remain a no on the bill for now, and that's because I don't think it meets various litmus tests that I have, but I would like to get to yes, because I do think the healthcare system as it is one of the biggest drivers of the federal deficit, and it's also one of the biggest problems for middle-class families and small business owners. Why? Because those premiums are going up, say, 12-14% a year. There are a lot of things that are driving that, I'm sure we'll talk about. Certainly the cost of the uninsured getting dumped on the insured is one of the biggest on that. So what are some of the tensions that are there that I'm trying to listen to a lot of voices on? Well, one is this issue about state lines that you mentioned in state competition, which is that a lot of people say you should be able to compete insurance across state lines. Well, for federalism reasons, that's tended to be a states' rights issues, and states have tended to be pretty protective. And I like the idea of doing it local if you can do it local, state if you need to, federal if you absolutely have to. But there has been a lack of competition within the insurance market in part because of the state-to-state complications on that. In terms of fixing Medicare, there are clearly things to fix about Medicare, and there are a few fixes that are in the bill. One, there's a major effort to go after fraud, waste, and abuse in the bill. Second, there is finally the ability to negotiate cheaper prescription drug prices for seniors, which was just a boondoggle in the earlier prescription drug bill. I think a handout to the interest groups, basic market principle to negotiate cheaper drug prices for seniors, and closing of the donut hole. In terms of the administration of the program, it's actually been administered incredibly efficiently at about 2% overhead, which is, well, no, it is administered extremely efficiently at about 2% overhead, whereas private insurance is 23 to 30 cents of overhead. What has not happened well is dealing with politicians stealing from the cookie jar and dealing with the demographic bubble, which is different than the administration of the program itself. So in terms of Medicare being able to efficiently manage competition between insurance companies and supplemental and other things, it's actually worked pretty well. In terms of politicians getting the mix and other things. But part of that is the same driver we see with private insurance, which is the cost per person has gone up significantly for healthcare for a number of reasons, and that's part of what we're trying to address here.